We have what we call phosphodiesterase inhibitors or PDE5 inhibitors. The popular ones are Viagra, as we all know. Then you have Cialis, Levitra, and Speedra. These are the first line of treatment for erectile dysfunction, and they block the PDE5 enzyme, which helps to increase the blood flow to the penis to cause an erection. However, if you've tried several PDE5 inhibitors and they've not worked, for whatever reason, then there are other options such as injections, creams, vacuum pumps, and even surgery. So for example, if you had a spinal cord injury, then you might benefit from these other options than taking tablets. So there is a drug called Alprostadil, which is injected into the shaft of the penis, which relaxes the smooth muscle to allow blood flow into the penis. Alprostadil is similar to the chemical prostaglandin, which the penis naturally produces when erect. You or your missus will be taught how to inject the drug, which is done slowly, usually over 5 to 10 seconds, and should be done 30 minutes before intercourse. It is advised not to use this drug more than once in 24 hours, not for 2 days in a row, and not for more than 3 times a week. So side effects of this injection can include swelling, bruising, and pain around the site of the injection. You could also get painful erections with this injection, and a lot of people end up going to hospital because of this painful erection. If you're not keen on injection, you've also got the option of a pellet, which is usually inserted with an applicator into the urethra. Ideally, it should be done after urination, and it then dissolves to give an erection. With the pellet, you should get an erection within 10 minutes and can last for up to an hour. Unlike the injection, MUSE can be used twice a day, and not more than 7 times in a week. The side effects are milder than injection, with mostly pain in the penis. Alprostadil comes as an injection, pellet, and it also comes as a cream, which is applied into the opening at the top of the penis. This can be done 5 to 30 minutes before intercourse. This is used not more than 3 times a week, just once in 24 hours, and the effects can last 1 to 2 hours. The main side effect with cream is irritation of the skin of the penis. Now you have what we call vacuum constriction devices or a vacuum pump. So a pump is placed over the penis and air is pumped out of the cylinder, which then creates a vacuum that draws blood into the shaft of the penis. The penis now swells and becomes erect. The pump is removed and the ring or band is placed at the end of the penis to maintain the erection. This can be useful in men with anxiety, but you might have side effects such as the penis feeling cold, so you might have to warm it with a warm compress, as well as swelling, bruising, and numbness of the penis. So if you've tried other treatment options and you're looking for a more permanent option, then look no further than penile prosthesis surgery or penile implants. You have a choice of inflatable or semi-rigid implants. So for inflatable implants, they can be put in the penis, can be inflated for erection, and can be deflated afterwards. And they're quite useful if you have issues of the anatomy, such as Peyronie's disease, which, as I said, is a penile curvature of the penis, which can happen as a result of fracture of the penis, for instance. However, the main downside of having implants is that they can stop you from having natural erections even after the implant has been removed. However, success rates are believed to be as high as 90% for surgery. Now, do not forget counselling. A lot of people focus on the medical treatments and forget the importance of counselling. We're talking about psychosexual counselling, which focuses on sex problems and relationships and can be done on your own or as a couple. So if you've got any physical problems which might be causing you anxiety and depression, or you've got relationship problems such as lack of sexual desire, or anything in general, then speaking to a therapist is a good option. So there are natural or herbal remedies or supplements that help with erectile dysfunction, but my focus is on the medical treatments for erectile dysfunction. Some remedies work, while with others there is no strong evidence base and there are concerns regarding the safety and efficacy of these remedies. i.e., what's exactly in it? Do you know what you're taking? How do you know it's safe? I'll probably cover this in another video, but one supplement that's well known is called L-Arginine. So L-Arginine, as we know, is an amino acid, and it helps with dilation of the blood vessels, which means in theory this increases blood flow to the penis to produce an erection. And some studies have shown that some men with erectile dysfunction problem had low levels of L-Arginine. However, unlike medication like Viagra or Cialis, which usually works within 30 to 60 minutes, if you take L-Arginine, that's not going to work within 30 to 60 minutes. So that means you have to take this medication for a long period of time before it actually works. And it might not work in some men, especially if you might not have low levels of L-Arginine, or if you have a medical condition already. Also, you shouldn't take L-Arginine alongside your PDE5 inhibitors because there's a risk of having low blood pressure, as well as other symptoms such as headaches or flushing. Now, I hope you found this video on erectile dysfunction useful. And if you like this video, please feel free to subscribe to my channel.